Hey everyone, Dr. White coming at you. Today we're going to talk a little bit about some orthodontic research, some new exciting research in the orthodontic space. So a blog that I follow, it's put on by a professor emeritus from the University of Manchester in the UK. His name's Kevin O'Brien, and he is a well-respected individual, academician in the orthodontic space, and my previous dean at the University of Louisville School of Dentistry, who was trained as an orthodontist, recommended I follow this as a way to get kind of some more CE. So well-respected source, and his most recent, or maybe second most recent post, which he put out on Halloween here, you'll see, talks about aligners versus fixed appliances or braces. It's a fancy term for braces. So this study, which is done out of Syria, compared cases where teeth needed to be removed. So crowding greater than 6 millimeters, where extraction treatment or removal of permanent teeth needed to happen. And they compared 18 participants in the clear aligner group and 18 in the braces group. And those were randomly allocated, which improves the credibility and minimizes the bias in the data. So what you'll see is that as we kind of scroll down here, the clear aligner group finished treatment in about 23 to 24 months, whereas the braces group finished right around 26 months. So a little bit of difference there, and none of this was statistically significant, but 3 months here or there in a 23-month process might be enough for somebody. So that's the length of treatment. As far as the outcomes, the level, the satisfactory level of the bite or crowding, no differences between the two groups. So we see, Kevin O'Brien is usually pretty bearish on aligners, which have traditionally been used to treat mild to moderate cases. We see now with extractions, which are difficult cases, that they can treat more difficult cases, okay? Cases that require more oversight. So fun research, and it's more exciting as the technology continues to improve and grows in age. We'll see more research, and you'll see, it does require compliance. You have to wear the aligners. The aligners don't wear themselves. But if you have compliance, they will treat just as good and oftentimes faster than braces. Sometimes we kind of have to choose one or the other, or we make it look like one's better than the other. It's not true. If you communicate the differences between the two and you give patients, what we do is we like to give patients the option. We say, here's what aligners can do and why they're convenient. Here's what braces are and why they're fixed to the teeth. And you go from there. So hopefully you got a little bit out of this, and we'll talk to you guys soon.